Dr. John Torres here with NBC News on my Daily Doc series, where twice a week I go over headlines. I talk about not just the headlines, but get into information about what that actually means, and particularly what it means for you, your loved ones, your family, your community. How it can hopefully help you stay healthy and get through this pandemic sooner rather than later. So let me first, and then I answer questions you have. So if you have questions, please send them our way so I can get to as many of those as possible. And they're, for the most part, very fantastic questions. So please go ahead and do that. But let me talk about the headlines first. One of the first ones I want to talk about is the upcoming emergency use authorization meeting to determine whether the Johnson & Johnson vaccine will be authorized to be used here in the United States. Now, to give you an idea of how this goes, so the Johnson & Johnson vaccine has been produced over the past few months, like the Moderna and Pfizer vaccine. The Moderna and Pfizer vaccine got their authorization, and now people are getting shots of those varieties around the country. Millions and millions of people have gotten them, and there's still millions and millions more to go to get us to that herd immunity level. But what we're seeing here as well is now with Johnson & Johnson, they have submitted their data to the FDA. And on Tuesday, the FDA gave their endorsement to go ahead with the emergency use authorization process. And so what that means is on Tuesday, and I'll walk you through real briefly what's happening here, is on Tuesday, the FDA came. Last week, Johnson & Johnson gave all the information to the FDA. They said, here is what we have. Here's all the data we have from our human trials. Here's why we want to get emergency use authorization to be used in the United States. And it's a process that we go through here that's very specific because they want to make sure that anything we use is safe and effective. And what they're finding out here is it seems to be very safe and very effective. So they got the information. The FDA looked at it. On Tuesday, they decided, yes, there's good enough information here. We want to go ahead and push forward with the emergency use authorization process. And what that means is today, Friday, right now, as we speak, an advisory panel to the FDA. They're a group of independent scientists, researchers, doctors, who their job is to look at the information and say, do you think we should go ahead and get this emergency use authorization? The committee is called the VRBPAC. It's the Vaccines and Related Biologicals Advisory Committee, VRBPAC. So I'm sorry. Let me get this again. The Vaccines and Related Biologicals Advisory Committee, VRBPAC. And so what they do is they meet today. When they meet today, they're going to come out with a decision later in the day. By all indications, their decision is going to go ahead and say, we recommend you give the emergency use authorization. Then tomorrow, the FDA is going to meet, and the FDA will say, okay, we got this information from VRBPAC. Our independent experts are saying we should go ahead and go forward with the emergency use authorization. We'll go ahead and either go ahead with the authorization or deny the authorization. And in this case, by all indications, they're going to go ahead and approve the authorization. Once they do that, then on Sunday, so this is Saturday we're talking about, on Sunday, the CDC Advisory Committee, called ACIP, the Advisory Committee on Immunization Practices, ACIP, they meet, and what they decide, so remember, at this point, the vaccine has already been authorized to be used in the United States, but as physicians, we have no idea how to actually use it at this point until we until we get the information from the CDC. At that point, the CDC says, okay, we know it's authorized. Here's how you use it. Here's how you transport it. Here's how you mix the solution, because usually it's in a vial, it's a powder form, and you have to put sterile saline in there, which is a solution we use at a certain amount of that. You have to mix it up a certain way, and usually they'll say, shake it 10 times gently or something like that. And then you withdraw whatever the amount is. For Pfizer and Moderna, it's 0.5 or 0.3 milliliters. This one might be the same, might be different, but that's what the CDC is going to say, this ACIP committee. They're also going to come out with recommendations on who should be getting it, and we've already mentioned the phases that they've talked about in the past. They'll be saying, okay, people in these phases ought to be getting it. It's approved for 18 and above or 16 and above, depending which way it goes. Here's how you transport it as well. They go through all of that, so that way, as physicians, when it comes to us, we know how to administer it. This is a recommendation on their part. Once they recommend how to administer it, then the shot is good to go. So remember, there's a few parts here. So today, the VRBPAC meeting, that Vaccines and Related Biologicals Advisory Committee, they meet and they basically say, yes, you should proceed with the emergency use authorization. We feel like the data is good enough to go ahead and proceed with that. So they advise the FDA. The FDA tomorrow more than likely will say, yes, we agree with VRBPAC. We're going to give it the emergency use authorization. Once it gets that authorization, then on Sunday, ACIP, the advisory committee to the CDC, meets. It's already been authorized, so now they recommend how to give it. the different ways to give it, who to give it to, and how to do that. And then once they give the recommendations, then the CDC director, who right now is Dr. Walensky, will sign off on it and say, yes, I agree with those recommendations. Let's proceed. So by all indications, Monday, trucks will start rolling. That Johnson & Johnson vaccine will get out there. And probably Tuesday time frame, maybe later in the week, people will start getting that Johnson & Johnson vaccine in the arm. Now, I do want to go over one specific point because people have heard about the effectiveness of the Johnson & Johnson vaccine, and that has some people a bit concerned, saying it doesn't seem to be as effective as it was, as the other two vaccines were, the Pfizer and Moderna. Because if you remember, Pfizer and Moderna were both around 95%. Pfizer 95, Moderna 94.1% effective. If you look at the data for the actual Johnson & Johnson, I'll look at it here, in the United States, 72% overall efficacy. But the thing you have to realize is Johnson & Johnson, they measured things differently than Pfizer and Moderna. Pfizer and Moderna looked at people avoiding all COVID. And so that was if you had sniffles, if you had low-grade fevers, if you lost your sense of taste or smell, they said, okay, that's an indication that you probably have COVID. Let's go ahead and check you. And it found out to be 95% effective at avoiding that. Now, when you look at the 72% overall effectiveness, they were looking at moderate to severe disease. And so they had stepped it up a level to these higher disease levels and saying, okay, it's 72% effective at preventing that. And I know it gets a bit confusing, but the best way to describe it is they were looking at apples and oranges. And so you can't directly relate these numbers. But a couple of numbers on the Johnson & Johnson side that are important to understand. One is it proved to be 86% effective at preventing severe disease. Now that's important, 86% effective at preventing severe disease. On top of that, when they were doing their study, as opposed to the other two, they were doing their study when these variants were coming out. And in the case of Johnson & Johnson, they did some of their studies in South Africa when the South African variant was the dominant variant down there. And they found out in that case, if you remember a couple of weeks ago, the number was 57% effective against that. Well, they've looked at the data again and said now the numbers are showing it was actually 64% effective against that. So they bumped up that effectiveness. And if you remember going back, a year ago or so, the FDA at the time had said, we're not even going to look at a shot unless it's at least 50% effective. That's what they were hoping for. And this one is showing 64% effective against avoiding moderate to severe disease. Again, those higher levels of disease around where the South African variant was. But perhaps the bottom line here, and this is the one thing I want to make sure that people understand, the bottom line with the Johnson & Johnson vaccine, and it was the same in the trials with the Pfizer and Moderna vaccine, in the Johnson & Johnson trial, everyone, regardless of where they were, that received the Johnson & Johnson vaccine, 28 days later, none of them were hospitalized. None of them died from COVID-19. None of them had severe illness. So at the end of the day, that's exactly what we're looking for. They avoided hospitalizations. They avoided deaths. And as I tell people all the time, if you get the shot and you end up with sniffles, no long-term complications, it resolves in 3 or 4 days, and you go on with your life because of the vaccine, that's a win. The vaccine has done its job. And so again, when you look at what's going on here with the Johnson & Johnson, don't fixate on the numbers because the numbers are calculated in a different fashion. And all of these shots are effective at stopping COVID-19 from taking effects in your body, from causing issues, and particularly all of them showed great effects at preventing hospitalizations and deaths, which at the end of the day is exactly what we want. And so for today, again, look for that VRBPAC to go ahead and meet. Give the thumbs up for the emergency use authorization. FDA tomorrow to second that thumbs up and say, yeah, we're going to give it the emergency use authorization. The ACIP, the advisory committee for the CDC, to meet on Sunday and say, here's how people should be getting the shots. Here's how to mix it. Here's how to administer it. And then CDC saying, yes, we're good with those recommendations. And then shots going out by the early part of next week. And so, again, things to think about. Now, one thing I do want to bring up is what's been going on in the news the last couple of days, and that's pediatric vaccinations. Now, a lot of these, Moderna just announced that, yes, they have just finally fulfilled the number of people they need for pediatric vaccination human trials. They've gotten the volunteers they need to do that. And on NBC, we've done stories of children who are volunteering for them. And, my hat's off to them for stepping up and their parents for stepping up with them and getting a full understanding of what that means, but at the same time going ahead and volunteering for these vaccinations. Now, of course, there has been a delay in children getting to these human trials for a very, very good reason. First, we want to make sure it's healthy on adults. And then once it's healthy and effective on adults, then we start looking at children, we start looking at pregnant women, we start looking at those other populations that we get more concerned about. But first we want to make sure it's safe and effective in the overall population of adults before we start working on children. And then they start looking at older children. Right now, like I said, they've fulfilled the numbers of requirements they need in order to get the human trials started for children, but these are 12 to 17-year-olds. And then they'll start working their way down, 5 to 11-year-olds. And then they'll start going 1 to 4-year-olds. And as you can see, they'll slowly start going down. The hope is by summertime that 12 to 17-year-olds can start getting their shots, high schoolers and middle schoolers. So by the time they go back to school in the fall, they're able to be vaccinated to go back to school. And so that's where we are right now with that. So it looks like children will start getting their vaccinations this summertime. That's the hope behind this. And my guess is within the next couple of months, you'll see them going for an emergency use authorization to bring that age down instead of 16 or 18, depending on the vaccine, down to 12 years old. And then eventually even lower than that. And so that's an important thing to think about. Why is the vaccine so important? Well, it's important obviously because you don't want to get sick from COVID. I don't want to get sick from COVID. I'm fully vaccinated at this point. So it does give me that as other experts have told me, it gives me that confidence and that comfort that I'm as fully protected as I can possibly be in 2021. I social distance, I wear a mask, I wash my hands, I avoid crowds, all those things. And now I have the vaccine as well. I'm beyond 2 weeks into the second dose. So good to go there. But also when you start looking at the numbers, I'll just go over numbers real quick here. United States, 28 million cases since the start of the pandemic, over 500,000 deaths, and we talked about that on Monday. But if you look here, right now here in the United States, and if I go ahead and focus on, I like to do cases per 100,000 only because that gives apples to apples comparison. Here in the U.S., cases per 100,000, 24 cases per 100,000. And so that number is still fairly high, but not as high as it used to be. If you compare other countries, United Kingdom, 15 per 100,000. If you look at Germany, 9 per 100,000. And then if you go to Japan, the reason I'm bringing Japan up is because the world is starting to think about the Olympics. And the Olympics coming up in July and August are going to be the first world gathering since the start of this pandemic. Right now, they're under 1 case per 100,000. It's 0.94 cases per 100,000. So they're doing a great job. But going back to the United States, cases now, yesterday 77,000. The day before, I think the lowest we got over the last couple of days was around 66,000. Sounds great because we were up at 300,000. But you have to remember that June of last year, we were getting under 20,000 every now and then, averaging around 20,000 a day. So that's a huge gap between 77,000 and 20,000. And so we want to make sure that we close that gap down even more. And even when we were at 20,000, all the experts are saying we need to get to 10,000. And so we still have a ways to go. And of course, that's up to human behavior and eventually vaccinations once enough people get the vaccinations. If you want a good primer on the diversity, the equity, and the inclusion behind the vaccine in those communities that are harder to reach and have been more vulnerable and at times haven't had the resources or the medicines they need to stay as healthy as they could, then go ahead and yesterday I did a Facebook Live where it's called Doc to Doc with Dr. Octavio Martinez. He's out of UT Austin Medical School, but he's also on President Biden's COVID-19 Equity Task Force. And he was talking about that. We had about a 20-minute conversation talking about how to make sure that all populations, including those that historically haven't been addressed, end up getting the vaccine because, as I often say, your community could have all the herd immunity it wants, but if the community next to it doesn't, then nobody has herd immunity. So we're in this together. But now let me see if you have any questions.
Is it true that the longer you are quarantined, the immune system gets depressed, it goes down?
So the question is it true that the longer you're quarantined, your immune system starts to get depressed? No, it's not true. And I'm assuming by quarantine that they don't mean quarantine because I was exposed to somebody with COVID-19. And in that case, there's a very specific quarantine period you go through. But what they mean is, I'm assuming what we've been doing for the last year, that all of us have been self-isolating. We have been making sure we don't gather in large groups, we don't go out with other people, we stay home as much as we can. And I know that's wearing on us, but at the same time, we're so close, we want to make sure that we stay as healthy as we can for the next few months while we get through this pandemic. Well, the main point is, if you take the time to do the things you need to do to stay healthy, then your immune system should actually probably even be stronger. And by that, I mean making sure you exercise, making sure you eat right, keeping your mental health as active as possible and as good as possible. And that means connections that you can make while you're there. And those are typically virtual connections, but just doing the things you can to stay healthy, both physically and mentally. And if you do that, then that'll keep your immune system healthy. On the other hand, if you turn into a 24/7 couch potato where you're eating junk food, you're not exercising, you're just sitting there watching show after show, then that could potentially produce an effect on your immune system where it makes it a little bit weaker. So you want to be very, very careful with that. And the main point being that if you are doing these things, if you are self-isolating like all of us are, then don't forget to exercise. Try not to watch too much TV. Try to make those connections with other people. Pick up hobbies. All those things you can do to improve your mental health or at least keep it fit, improve your physical health or at least keep that fit as well. And that should keep your immune system fit as well.
Why the third Pfizer vaccine? When will we know if we need this extra shot?
So the question is, why the third Pfizer vaccine? When will we know if we need this extra shot? And that's coming about because of the news. Pfizer is now looking at, do we need a booster shot? And starting to look at the process for developing a booster shot. Now, because of the variants that are out there, and there's 3 variants of concern. One is the B.1.1.7. That's the one that was first discovered in the UK. That one we know is more contagious. It's easier to catch. It's easier to spread. It's in well over half the states here in the United States, but we don't think it's the dominant strain as of yet, although we are ramping up our surveillance program. On top of that, we have the B.1.351, which is the one first discovered in South Africa, and that's the one that has most experts worried because not only is it more contagious, but it looks like it could possibly be more dangerous as well. And then we have the P1 out of Brazil. That one hasn't become too dominant across the world, and so although it's aligned with the South African variant, the B.1.351, in the fact that it's more contagious, possibly more deadly, not something we're worrying about as much at this point. But the bottom line being that with these variants, we know that with the B.1.1.7 out of UK, that the vaccines seem to be fairly effective against that. Out of the South African, the B.1.351, and the P1 out of the Brazil, they don't seem to be quite as effective, but they still have good effectiveness. And like I talked to you about the actual Johnson & Johnson vaccine, 64% effective against the South African variant, but at 64% effective at stopping moderate to severe disease. That's an important point to make because they looked at the high end of people's disease from coronavirus, not at the more milder symptoms. And at the higher end, at 64% of the time, it worked against them. And I don't know if you remember in the past, experts were talking about the cushion effect. So these vaccines are so effective that they still have cushion room, might not be as effective. But that having been said, we don't know where these variants are going to turn. And so right now, Pfizer is looking at it saying we might need to produce a booster shot. And if we do, we want to start the process now and let people understand you might be getting a booster shot in the fall, which would be kind of in line with getting flu shots where you get them every year. We don't know if we're at that point yet, but the important part is the way these vaccines were made, particularly Pfizer and Moderna, it's an mRNA technology. That technology allows them to change very quickly how they need to adapt to the variants. And they can do, per them, in 6 weeks, basically change the formulation in these vaccines to make it more compatible with the variants and change it into a different booster shot. So we're lucky in that manner that the technology is there that we can do this very, very quickly. But we'll have to see where the variants go. We know there are other variants cropping up. You might have heard news about other variants across the country. The one word of sort of advice there is when you hear about these variants, you're going to continue to hear about variants. It's almost that one of those, the more we look, the more we're going to find, but we don't know which ones actually have real world implications. We know the UK one does because that's here now. That is becoming more widespread across the United States, and it's proving to be more contagious, meaning you can catch it and spread it more, and so that's of concern. The South African variant, still fairly under control here. The Brazilian variant, still under control here. So even though those variants are there, and you're going to continue to hear about more variants, we don't know what the real world implications are for that. But this is how viruses act. When they get in our body, they can change. Sometimes those changes make the virus weaker. Sometimes they make the virus stronger. And in the case of the stronger ones, that's when we get more concerned. But thanks for the question. Now, just going over the headlines again. Today, the FDA advisory committee is meeting. They're going to give thumbs up, more than likely, by all indications, for the emergency use authorization. Tomorrow the FDA will meet and they'll second that and they'll say, yes, they're going to give the emergency use authorization. It's typically not till late in the day because they have a lot of paperwork they have to do in order to go ahead and release it for the emergency use authorization. And then ACEP, which is the advisory committee for the CDC, and the CDC director tomorrow, or Sunday, will decide on the recommendations on how to give it, the dosings, the intervals, all those things. And then come Monday, trucks will probably start rolling with the Johnson & Johnson vaccine, and people will start getting shots in arms shortly after that. That's that one. Peds, they're still looking for pediatrics. They're still looking at the human trials for kids. They want to make sure it was safe in adults first. Now they're going to start looking at kids. And I get the question all the time, why can't we just give them to the kids? Because we know they're healthy in the adult population. Well, with kids, one thing they always talk to us in med school is kids are not small adults, which basically means just because it works in adults, you can't give the same thing to children. Dosing might be different, intervals might be different, everything might be different, so they need to be studied before people just give them to them. And it's very, their immune systems react differently, their bodies react differently, the side effect profile might be different. We want to make sure that's why they're having trials with children. And then on top of that, the cases, yesterday 77,000 cases, which is great because it's much less than the 300,000 we had just a few months ago, but not as good as the 20,000 we had back in June of last year. So we still have a ways to go, and that's incumbent on us doing those things we know we need to do. Wear a mask, wash your hands, watch your distance, and make sure you don't gather in large groups. But otherwise, it being Friday, I hope you have a wonderful weekend, and we'll talk to you next week. But in the meantime, I hope you, your family, your loved ones, and your community stay as happy and as healthy as possible. Thank you.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.